You're the only nurse available. 4 patients need your attention at exactly the same time. One of them could deteriorate within minutes. Who do you see first? Pause the video and make your choice. Welcome to the very first episode of Think Like a Nurse, where we don't just memorize facts, we learn how to make safe clinical decisions. Today's challenge is based on a realistic ward scenario. There isn't time to see everyone at once, so prioritization is critical. Let's look at the patients and their data. Patient A, Mrs. Johnson, 76 years old, is struggling with increasing shortness of breath. Her respiratory rate is 30 and oxygen saturation is 88% on room air. She looks anxious and is struggling to complete sentences. Patient B, Mr. Ahmed, is 45 years old. He has a temperature of 38.4 keys and is waiting for antibiotics. He's alert and talking comfortably. Patient C is Mrs. Brown, 82 years old. She requests help to the toilet. Her observations are stable. She is comfortable in bed. Patient D, Mr. Lewis, 58 years old, pain score 7 out of 10. He's waiting for his prescribed pain medication. His vital signs are stable. Pause. Take 10 seconds. Who are you choosing? Comment A, B, C, or D. The correct answer is patient A. Why? Because airway and breathing always come first. Let's break it down. Clinical reasoning. Respiratory rate 30. This is significantly elevated. Oxygen saturation 88%. This is below the normal range and suggests hypoxemia. Unable to speak full sentences, this indicates severe respiratory distress. Anxiety. Patients with hypoxia often become anxious before they deteriorate further. ABCDE assessment. Airway open. Breathing compromised. Immediate assessment needed. Circulation monitor. Disability. Assess consciousness. Exposure. Look for underlying cause. Why not the others? Patient B, important, likely infection, needs antibiotic promptly. However, airway and breathing are currently stable. Patient C needs assistance, but not immediately life-threatening. Patient D's pain is important. However, pain alone is not usually prioritized above compromised breathing. So we assess patient A first due to their low oxygen levels. Then we address patients C and D. Remember this, patients don't always tell you they're critically ill. Their observations do. The key takeaways. Always use ABCDE, prioritize life-threatening problems, treat breathing problems immediately, use News 2 where appropriate. Never prioritize comfort over a compromised airway or breathing. Remember these priorities for safe patient care. If you chose patient A, well done. If not, don't worry. Clinical reasoning improves with practice. Tomorrow's challenge is even harder. 2 patients are deteriorating, but only 1 can wait. Who would you see first? A, B, C, or D? Would you make the right decision? Subscribe to Nurse IQ.